Thank you. Thank you, Mr. Chairman. Thank you, Ranking Member Rowe. And I appreciate you including two of my bills, HR 7541 and HR 7879. We all know that one veteran death by suicide a day is too much, and our goal must be to bring veterans' deaths by suicide to zero. That is why I'm proud to introduce HR 7541, the Zero Suicide Demonstration Act, with my colleague, General Bergman. I'd also like to thank the Paralyzed Veterans of America, American Legion, VFW, Disabled American Vets, Minority Veterans of America for showing their support for this bill. Of the 20 veterans a day who take their life by suicide, only about 6 of them are accessing the VA. We have focused much of our suicide prevention work on trying to reach those 14 veterans who are not accessing the VA resources. But the Zero Suicide Initiative focuses on those 6 suicides per day of patients within the system. It builds on the VA's suicide prevention efforts by implementing a more comprehensive systems focused zero suicide efforts in pilot programs at 5 VA medical centers, with one serving primarily rural veterans. This initiative is based on the Henry Ford behavioral health model that pioneered and conceptualized zero suicides as a goal to develop a care pathway to assess and modify suicide risk for patients with depression. This approach starts a new culture based on the premise that no suicide is fated. I'd like to clear up a couple of misleading claims that the VA stated regarding this bill. First of all, this bill does not implement a suicide prevention program education curriculum of one specified nonprofit organization. It is rather based off of a proven medical approach that has been published in many multiple medical journals. And secondly, it does not statutorily mandate that all VHA healthcare systems must use this approach. In fact, pilot programs like this are quite the opposite. This bill has VA run a pilot program to see if this approach is better than what the VA is currently implementing. It also offers an opportunity for the VA to bridge its systemic gaps in care for veterans patients who are at risk of suicide and compare those differences between the models to come up with the best practices and related health outcomes. If we can show that the Zero Suicide Pilot Program can strengthen the VA's current suicide prevention program, why wouldn't we run this pilot program? Our nation's veterans deserve our full support, and this bill, with the support from both parties, shows our veterans that they're not alone. The second bill being discussed today is HR 7879, the VA Telehealth Expansion Act, which I was honored as chairwoman of the Technomod subcommittee to introduce with my colleague, Ranking Member Banks. This bill seeks to close the gaps in the access to the VA telehealth by allowing VA to provide grants to outside partners, creating and upgrading technology access points for veterans. Quality telehealth services are vital to veterans to access quality health care, obviously, during the COVID 19 pandemic, especially for veterans in rural or medically underserved communities. We cannot let this pandemic compromise healthcare services for our veterans and service members because of COVID 19. Because of COVID 19, telehealth video visits at the VA have increased by over 1,000% between March and June of this year. In my home state of Nevada, Southern Nevada Healthcare System uses the VA Video Connect, which delivers care to veterans in their home via a computer, a tablet, or a smartphone. On the week that Southern Nevada started responding to the COVID 19 pandemic, their VA Video Connect encounters were 128. Fast forward to the week of July 19th, and they were providing 2,225 encounters to veterans via Video Connect. So even though the VA has expanded their telehealth capacity, many veterans still have limited access to telehealth service. This clearly is no time for excuses, and it's our responsibility to adapt changes thrown our way. Our bipartisan bill will make sure that local VA facilities have the capacity and the technology to provide telehealth services, and that veterans in all communities have access to quality health services that they have earned. So thank you, Mr. Chairman, and I yield back the balance of my time.